plastic surgery and pain. I get this all the time from patients. Is the procedure going to hurt? Is it painful, Dr. Mulholland? What's the pain like? And there's no question that patients' experience of a procedure influences their perception of outcome. It certainly affects their willingness to come back and do maintenance. So anything in plastic surgery and non-invasive and invasive aesthetic medicine that we can do to reduce pain is wonderful. So what do we have? Well, we have topical anesthetic. That helps a little bit with needle-based and laser-based treatments. We've got local anesthesia, which is injectable, and that causes pain to remove pain. It's a little bit more invasive. We've got oral pills, such as opioids and narcotics. And for obvious reasons, those might not be optimal in a plastic surgery outpatient setting because patients have to drive after. And so topical chillers, air chillers, which acts as a good distraction and can numb some of the sensory fibers. We've got vibrating apparatuses and distraction like squeezing balls. These are all okay to distract or reduce the perception of pain. But one of the biggest advances, innovations in pain that I've seen has been nitrous oxide. The use of nitrous oxide, nitrox, or Pro-Nox, these are trade names for a gas. Nitrous oxide gas. We have it in the atmosphere and we use it in higher concentrations with inhalation. It's also called laughing gas. So why does it work and why is it effective? Inhalation of nitrous oxide in the right percentage very quickly releases dopamine and serotonin in the brain, and it gives you a sense of well-being, a giddy sense of well-being that distances you from the pain. Its on time is quick, its off time is quick, patients can drive after, and it literally takes an 8 or 9 out of 10 for experience like lasers and fractional lasers and fillers and makes it a 2 out of 10. So nitrous oxide is one of the best modern methods to give patients a much more comfortable aesthetic experience. Our patient Roz Morgani today is your quintessential and typical bruxer. She's been grinding nocturnally for many, many years. It's led to masseteric clenching muscle hypertrophy or enlargement, which is a change to her aesthetic appearance. It's given her a square jaw, a masculine jaw, rather than the youthful, oval, feminine face she's looking for. It's also changed her dental occlusal surfaces. The grinding has changed the cusps that occlude and has gradually sanded away good occlusion. It's given her temporomandibular joint pain from grinding and pushing and hydraulically impacting on this joint, the TMJ. It's led to TMJ pain. She also gets spasm. She gets migraines. So it's given a cosmetic and a functional effect on her life that's been very negative. And so the treatment for this has been typically a splint, which helps her occlusal surfaces, but will not necessarily help for the spasm, the hypertrophy, and the pain in the TMJ. So we're going to see a very unique and novel treatment and use of Botox today, which I've been doing for many, many years, which is Botox for masseteric hypertrophy. Now, most commonly, I'll use it to shrink down giant masseters in females to give them a more feminine oval shape and reduce that square jaw. But in Roz's case, she gets the double effect to increase a more feminine look to the square, masculine, masseteric angle to her jaw and give her an oval face, but she also is going to get less spasm, less TMJ pain, and fewer headaches. So she falls into that unique combination therapy with Botox, the masseter, pain and aesthetics. Roz, good to see you again.
Hello, nice to see you.
So we've been doing injections for a good 15 years, and today we're going to do a little facial shaping, some upper jawline zygomatic arch augmentation, and then trying to shrink down the strong square jaw with some masseteric Botox. And so you've had injections now, Botox and fillers, for a good 15 years. I can't imagine you wake up in the morning of an injection thinking, goody, another injectable day. Is it painful, and do you have some apprehension every time you come?
Well, it's interesting. You know, it used to be very, very painful when we first started, back in the day before we had the technology and the products
and
that we
different
have
techniques, or products with local in it.
Exactly,
Yeah,
and that's improved it.
Yes.
But it still is painful, right? And there's still an edge there that, you know, if there's a way to take that out of the equation, then yes, I'd be hopping and skipping here.
So you don't wake up looking forward to injection day. But you're right, we've had microcannulas, we've had Juvederm or Restylane with lidocaine in, all of them have helped. The next phase, which you're going to experience today, is called nitrous oxide. Now, most patients our age, baby boomers, have had nitrous oxide their dentist's office. It's called laughing gas.
Right.
It's a great option because you take a few puffs, it releases immediately a whole bunch of neurotransmitters called dopamine and serotonin, which are the feel-good neurotransmitters. So you get this brain full of this well-being chemical, and it squashes that sense of pain your hypothalamus is telling you, hey, this hurts, what are you doing? And your brain is going, yeah, but I don't really care.
Right.
And so it gives you a sort of out-of-pain experience. You're not truly high like mind-altering narcotics would make you,
Right.
but you certainly feel giddy, you feel happy, and you know the pain's going on, you just don't care about it.
Oh, I'm looking
And
forward
so
to this.
I'd love to give you this opportunity because you've been a long-term injectable, and to a person, and these are women like yourself, oh, I don't need this Botox, I've been doing this for 15 years. You try it once, you go, oh my God, I'm never going back to not using this is great.
Right.
And so we'll do our inject today with nitrous oxide, and I think it'll be very interesting to see your impression of this new opportunity.
I'm excited.
So here we are, Roz, now back for our yearly facial shaping journey. Let's take a look together in the mirror. About down there is perfect. And so again, we want to create a very nice, you can take the glasses off now if you want to, perfect, and just put them up like that. And we want to really accentuate that beautiful cheekbone you have. Maintain that high zygomatic arch here. Not too much on that puffy central cheek. That makes one look chubby, not youthful. And a nice high cheek sweep here will be wonderful, okay? And then from that same point, I will add a little bit right here on that under eye where it looks a little tired sometimes, right here, and that will give you the upper face. Of course, as we get older, we get that strong down, yes, exactly. So you have a strong depressor angularis oris. We use a little Botox to uncouple that muscle, relax, and then a tiny bit of filler to fill in that little facet that looks hollow. And that will hide the jowl that lives beside that little facet here. And so that will hide the jowl that lives on either side of it. And that large masseter creates a very square jaw. It conspires with your jowl to create that heavy lower dowdy look to the jawline. So we're going to soften the jowl, soften your masseter, lift the corner of your mouth, and open your cheekbone. We're going to do that with Botox, soft tissue filler, soft tissue filler. So pretty much the same plan we've always done. We're just going to add the masseteric reduction, or the jawline clenching reduction. Now, as we discuss, you don't wake up excited and happy about your injection day. Now, hopefully that will all change. If you see this right here, this is the tubing we use for nitrous oxide, or laughing gas. And simply we hook this up to our nitrous oxide tanks that we use in our injection practice all the time now. And coming through that tubing will be some oxygen and nitrous oxide. So you get good oxygen in and nitrous oxide. You breathe in as if this was a snorkel and you're swimming in the Bahamas looking at all the fish. Lock your teeth and lips right around that obturator. And when you breathe out, you push the gases that way. So in come the good, out go the bad. You don't have to breathe any of the air around you. And within 4 breaths, you're starting to feel that sense of giddiness and well-being, which will definitely impact upon your perception of what's going on. And so this has been a huge benefit for the injection practice. So I'm looking forward to you who's been doing this for 15 years, trying this.
Okay.
So here's how it works. Take your dominant right hand, and then just like you're snorkeling, put your teeth and lips around that, form a tight seal so nothing gets in there but the inspiration. So big breath. Now, not a fast breath. Hold it, and then out through the same tubing. Out through again. There's a little ball valve here, it forces out the pink tube. And then you wait a couple seconds, then hold it, and then breathe out. So slower, deeper breaths, okay? Now what I'm gonna do is put you back to relax you here. We'll get you nice and comfy, okay? Chin up in the air, and just feel free to enjoy our session today. Nice, slow, deep breaths, okay? And so while you're doing that, I actually clip off with a little nose clip the bad air of our normal atmosphere. Okay, Roz, nice deep breaths of the laughing gas. I'm gonna go after your clenching muscle, your masseter. Clench for me. Big clench, there you go. I'm gonna go right into your jaw muscle, and we're gonna start putting that to sleep. And it's gonna be relieving that facial shape very quickly. And again, give me a good clench. Excellent. Again, clench for me. right into the masseter muscle. Excellent. Perfect. Right into the masseter muscle. You can feel the pressure in the muscle. It feels a bit different than doing skin injections. One more time. Big clench. Clench your teeth. Clench your teeth. Excellent. Very good. Right into that clenching muscle. Very good. Okay. So that is our injection in the clenching muscle on this side. Okay. Now we're going to relax that muscle over the next week or so as the Botox takes effect. Now we're going to go back and do some of our more typical treatments that we do with you. We are going to also build up your zygomatic arch. We're going to go to a micro cannula and we're going to use some Juvederm to create some fullness. Nice deep breaths. I'm going to create a little access port here. 1, 2, 3. We're going to park our micro cannula and we're going to take a little bit of Juvederm volume to go right up that zygomatic arch. So we go through our little port, go right up the arch to create a nice contour and shape, okay? And there's a little bit of lidocaine inside this gel. We're going to build up your cheekbone nicely. Very nice, nice and even. Nice and even. And we're going to create a zygomatic arch to make up for the square jowl, and we're going to weaken your masseter muscle to create a beautiful anime shape, a much more youthful shape. Nice, slow breaths. You're doing great. I inject nice and slow on the return. Beautiful. Nice. Excellent. So a little zygomatic arch shaping here. Very nice. Beautiful. Excellent. So a nice hyaluronic acid sugar gel. Juvederm Voluma, very common product here. Princess Volume, Restylane, Perlane can all be used here to create that shape. What we're doing today is making this the most comfortable injectable you've ever had. Nice and easy. Beautiful. Okay. Nice and easy. Nice, slow, deep breaths. Excellent. So 1.5 syringes back to you, Julie. Come on out. How are you feeling? Now you've done this without that before. How does this compare?
Oh my goodness.
Well, that pretty much says it all. Yes. That's why they call it laughing gas.
Wow.
Huge benefit.
That's
now we're not done.
amazing.
It is amazing. So go back to those fish and that reef and that snorkeling and let's continue our journey. Okay, so now we're going to do what we've normally done here. We're going to put the DAO to sleep with a little Botox. And so I'm going to get you to make the angry scowl, make a mouth pout. There we go. 1, 2, 3. We put that little DAO to sleep. You also recruit your mentalis. You get that little pout orange, so we'll soften that a little bit. And once we've uncoupled your muscle, then we're going to put the corner of the mouth with some volume. The corner of the mouth, we're going to lift that. So back to our micro cannula, and I'm going to create a little pre-gel sulcus here. 1, 2, 3. Nice, slow, deep breaths. Nice, slow, deep breaths. And we'll go ahead and build up that pre-gel space. Nice and easy. Beautiful. Now we're hiding your jowl here. Hiding your jowl. And then we're going to shrink your masseter and augment your zygomatic arch. And that triad creates a beautiful oval shape, almost an anime type of shape, an exaggerated, Japanese cartoon character to create a very youthful look, that oval look, that fullness of youth, okay? Now once I've created a jawline, I turn. I'm going to support the corner of your mouth. Nice, slow, deep breaths. This is typically the more painful area of our injections. And with the nitrous oxide, you can feel what's going on. You just don't seem to care so much because you're able to overlap the pain sensation with the serotonin and the dopamine. And Julie, I'm going to finish up here with a little Sharpie to lift the corner of her mouth up. And then we'll take a look at the mirror at your facial shape that we've been able to achieve here in just a couple of minutes. And we'll talk a bit about what was it like? You've done injectables many, many times. Would you ever do it again without the use of nitrous oxide? So let's have a good look at you here in a second. Julie, can you give me a Sharpie now? And we'll just lift the corner of your mouth where we want it to be. And this will finish our half journey. And we'll just have a look in the mirror, talk about the experience, from a woman who's done 15 years of injectables, the use of laughing gas in this whole approach. Very nice. I love that. That looks really good. Excellent. Okay. Okay, so we're going to have a look in a second, take a look at your contour and talk about the use of nitrous oxide in your injection experience. Okay, Roz, I'm going to sit you up here. You've done great on the first half. Come on out there and let's talk about the use of nitrous oxide. Well, I don't think we have to say much because not many people are going to finish a half injectable and laugh about the experience, but have a look right here. You can see what we've done. First of all, we've accomplished that. Your master's going to shrink, your jowl is gone, your corner mouth is up. Looks awesome. What was that like? We just injected 3 syringes of Juvederm. We did, about 100 units of Botox. You've done 15 years of injectable. What do you think of nitrous oxide?
Wow.
Totally different.
Wow, I'm speechless.
So you could feel what was going on, right?
Yeah, totally.
And what was your brain thinking?
But I was like, oh, okay.
Yeah, you didn't care.
No,
and so to a
not at
person,
all.
I've been doing now nitrous almost a year. People who, like you, have been doing injectables forever think, it's just Botox, I don't need it. Once they've done it once, they say, I'm never going back to not using it.
I can see it.
It makes it kind of like fun pain.
Oh my goodness, it was so fun.
Okay.
Can we do this again?
Let's do the other half. Okay, Roz, I'm going to take off my goggles. We're going to sit you up here. Come on off. Now, you've done injectables for many, many years. Take a look at your lip. Looks nice.
Wow.
Yeah. So you've had lip augmentation. Typically, of all the areas in the face, is the most painful. What did you think with nitrous oxide?
It's amazing.
Yeah. Did it hurt?
I sort of had a sensation that there was something there, but I can't describe it as pain at all.
And how do you feel now? Do you feel giggly?
Yeah.
Says 1,000 words. So again, I think for your injection practice, nitrous oxide becomes critical to the patient perception of comfort. The next time she does all this again, she's not going to wake up with apprehension, dreading the day. She's going to go, wow, I'm actually kind of looking forward to it. And so Pro-Nox allows the patient to truly dissociate from feelings of negativity and pain, actually enjoy and reinterpret that pain, so beauty becomes fun. Fun pain. That's what nitrous oxide gives us. Roz, good to see you back.
Oh, hi.
You're looking great.
Thank you. It's all because of you.
Well, you and your vision too. And so we had quite a day that day. We did some volume shaping with a micro cannula all over the craniofacial skeleton. We softened your masseter. We did Botox brow lifting. That's a lot of needles. Now, this is the very first time in perhaps 15 or 20 years of doing injectables with me that you had a chance to use nitrous oxide. What did you think?
Wow, it was incredible.
It was
incredible.
It made it a worthwhile addition to your injection process.
100%. 100%. It really, really improved the experience.
Okay, well, you've been doing this a long time, so clearly you could tolerate the injections. Now, tell me what it felt like as you did your 4, 5, 6 deep breaths. What was your mind thinking while these needles were happening? Did you even know they were going on, or how did you interpret them?
So I did. I was aware of everything that was going on.
So you knew there was some pain.
Yeah, but it was very distant.
Okay. So you felt like you're outside the pain.
Exactly.
And now how many breaths, or how long till you start to feel that sense of well-being?
It was just a couple of breaths.
So a few breaths. You started to feel. Would you say you felt aware but a bit high, or you felt in touch with yourself but distanced from the pain?
That as well. Probably the equivalent of having about 5 or 6 drinks.
Okay, so
I'd say like nice buzz,
okay,
right? And that very sort of light ethereal feeling. Being aware but very distant and not really caring.
Well, so it's like you could feel the pain but you didn't care about it.
Yeah.
Well, that's what I hear from a lot of patients. So as you know, when you breathe in, the nitrous oxide releases almost instantly a lot of dopamine and serotonin. Those are the neurotransmitters of well-being. So it gives you a kind of inappropriate sense of well-being amidst the horrific pain that sometimes you're going through with these laser injectable treatments. And so let's say you were to say that injectables were an 8 out of 10 on pain when you do like fillers and Botox. what improvement on that out of 10 scale, 10 being the worst aesthetic discomfort and just being maybe an 8? Where would this put it? How much lower did your pain perception become, do you think?
I'd say about a 2.
Wow, so an 8 out of 10 down to a 2 out of 10.
Yeah, it was very manageable. It was almost, not even uncomfortable, I would say. It was there, and I was aware it was there because I've experienced it before.
Right.
But I would imagine if I'd never experienced it before and used it, it would be a little bit different,
You'd
right?
say, oh, that injection stuff's nothing. Why are these people complaining?
Yeah.
Okay,
was
so
very
it
good.
really reduced your experience. And now, any side effects?
None.
Were you dizzy, nauseated?
Nothing.
Some people get some side effects. It's rare, but you had
Nothing.
none.
Nothing.
Excellent. And how long did the effects last for? Like, did you feel safe driving home?
Totally. I mean, a few minutes after we were done, I just sat and iced as I normally do, and I was good to go. So
Yeah. So I do tell patients that the studies show you can legally drive within 8 minutes, and you felt, pretty competent at the wheel.
Yes.
No,
Fine.
no persistent side effects.
Nothing.
Okay. And now the big question: would you ever do injectables again without nitrous oxide?
Probably not.
Given the option, you would always select that.
100%.
Now,
Yes.
I've had that universally.
Yes.
I've made it a big part of everything I do, from fillers, energy-based treatments, to being in the OR, getting your freezing, have a home unit. I think it makes
100%.
life a little more tolerable in those few moments where we have to put up with discomfort.
Yeah. No, I agree.
Excellent. Well, next
Yes.
time I see you for your injectable, we'll fill out the nitrous oxide.
Perfect.
Okay?
Thank you so much.
Good to see you again.
Thank
okay?
you.
So we got to see a great episode with Roz today. We did injectable soft tissue fillers. We did injectable Botox for Botox brow lifting. We did soft tissue fillers to the lips. We did mesenteric Botox. And she said it all. The giggle and the smile she had when we talked to her after said it all. Pro-Nox and nitrous oxide tremendously reduces the perception, the reality of discomfort and pain during an aesthetic procedure. We took her from a self-admitted 8 or 9 out of 10 on discomfort down to a 1 or a 2. In fact, as is often the case with my patients, once they've had nitrous oxide once, they never ever want to go back. So nitrous oxide as a industry-leading modern treatment to safely and effectively decrease discomfort and pain to fun pain, to acceptable pain, has become an indispensable part of every aesthetic practice.